So, with the new restrictions on long-term care and retirement homes being released yesterday by the MOH for Ontario, it appears like it might be another lonely Christmas for long-term care residents, which, that does a lot of harm in terms of their mental health and depression, that kind of thing. So, do you support what was handed down yesterday? It kind of boggles the mind a bit that a resident who wants to go home to see their family, maybe overnight, maybe they live out of town where the long-term care home is, they're going to be discharged from the home and then readmitted again. It just seems to me like it's very heavy-handed. What are your thoughts on that?
Mm-hmm. I think, as you point out, this is a really delicate balancing act. We know that there are harms associated with the public health measures that we're using to try and prevent infection. And that includes mental health, emotional health. We know that there's ramifications in all areas of health. I think that we are so far along in the pandemic. In some ways, we're forgetting the very significant toll that COVID-19 had on long-term care homes in the very first wave, with very high mortality rates associated with that, and some homes being impacted particularly hard. We, I think, have had some comfort in knowing the protective effect of vaccinations against long-term care among residents of long-term care homes, and that has provided a sense of caution or of comfort as we've opened up some activities. I think right now with Omicron, there's a very significant concern that we don't want to see I think really significant impact on long-term care homes that we did in the first wave of the pandemic. So it's absolutely a very delicate balancing act. And I think, if nothing happens, people will say that we didn't need it in the first place. And then if something happens, we'll say that it wasn't strong enough. So this is part of the ongoing road of this pandemic.